You're listening to Ask the Advocate, a podcast series that features advocates for domestic violence, sexual violence, and all other survivors of abuse and serious crime. I'm your host, Billie Jo Weyant, and for the past 3 decades, I've worked in the victim services industry, serving as the executive director for a Pennsylvania-based nonprofit named CAPSI, which stands for Citizens Against Physical, Sexual, and Emotional Abuse. I invite you to join me as I sit down with my guests each episode to discuss critical victim service resources and to help raise awareness for the most pressing challenges facing survivors and the nonprofit agencies that serve them. Hello, everybody, and welcome to this episode of Ask the Advocate. I'm Billie Jo Weyant, Executive Director of CAPSI, Citizens Against Physical, Sexual, and Emotional Abuse. I've been in the victim service field for over 30 years, and I'm so happy and proud to have with me today a very special guest, someone I've known for many years and who has been very, very influential in the world of sexual violence. And her name is Barbara Sheaffer. We lovingly call her Babs, and it's okay if I call you Babs throughout this podcast. Thank you. And Babs is a Resource and Advocacy Director and also the Medical Advocacy Coordinator at PCAR, Pennsylvania Coalition Against Rape. Welcome today and welcome to our podcast, Babs. I am honored to have you here with me today.
Thanks so much, Billie Jo. I'm thrilled to be here. I appreciate it.
Thank you so much. Can you tell us a little bit about, I think everybody would really like a little history piece on how you started at PCAR and your role there today?
Sure. So I've been at PCAR for 24 years. I started out many years before joining the Pennsylvania Coalition Against Rape as an advocate. I was a volunteer at a local rape crisis center in Lancaster County. Then I was involved with sexual assault and domestic violence services in Arlington, Virginia. Then came back into Pennsylvania, worked in Reading for some period of time at the Rape Crisis and Domestic Violence Center there. Did a little bit of work in hospital administration, and then came here to PCAR. My job involves providing support, information, resources, and training to advocates across the Commonwealth. There's a network of rape crisis centers, so there are services for survivors and their families in every county in Pennsylvania. So I see advocates as sort of my main constituents. I also work closely with sexual assault nurse examiners, or SANEs. I know we'll talk about them in a little bit.
Right.
And I see my work both on the state level and national level really is largely like working behind the front lines. I'm providing those services and support and trainings to the people that are out there providing assistance and help in their communities.
That's wonderful, Babs. And you know, CAPSI, for as old as we are and for as many years as I've been there, it was about a year ago that we were able to finally get a medical advocacy program started for Elk and Cameron counties. And I know that we are also going to talk on a more broad scope as we get into our discussion here about certain different areas across the nation and how folks can, really find out in their own communities what they can do as far as medical advocacy and things like that. Because mainly, like what we're going to talk about today, and I do want to frame this up for folks, is we really want to concentrate on the critical need for medical advocates throughout the Commonwealth and throughout the United States and abroad. I think that the impact they have on survivors is paramount, and just as advocates do, as I've seen every day for a long time. And it's just something that we really, really need every center to have. And I'm really excited again to have you on here today and talk more about that. And I know that before we get started on that, we do have to make sure everybody's aware that this month, the month of April, we celebrate Sexual Assault Awareness Month. And we've been doing that for many, many years, Babs. And if you could talk a little bit more about that and help everyone understand that and what we all do on a local level, statewide, and above to honor our survivors and also provide that awareness piece.
Yeah, absolutely. So, April is Sexual Assault Awareness Month, and it is a time really to shine light on this unfortunately very prevalent issue. Sexual violence affects people across the lifespan. And so, this is an opportunity to make sure people are aware of it, and also make sure that there is help, hope, and healing available. And CAPC is an organization that can provide that help, hope, and healing, just like the rape crisis centers across Pennsylvania. And again, it's an opportunity just to provide more understanding and education on the issue, and also focus on prevention. That's a very important aspect as well. How can we work within communities to prevent sexual abuse, harassment, and assault, and make for healthier communities?
Some of the things CAPSY's doing, just to give a quick, brief overview, and I know this is going on all over the place, is we had our county commissioners proclaim April as Sexual Assault Awareness Month. So we did that, and last Tuesday I was honored to be a part of their commissioners meeting and accept that proclamation resolution, and also provide a brief presentation on how that movement came to be, and I spoke about all of that. So I was very honored for that. Also, we are doing a lot of community-wide events, and anyone, I mean, everything is on our Facebook and Instagram page at CAPSY for that. And this is a perfect segue talking about community-wide events leading into the Medical Advocacy Project, because our medical advocate, who was recently hired only in January, so she's brand new, it comes well versed and she has a vast background when it comes to that. But the community wide event piece, everything that she's attending or doing, we're also pulling in, that awareness piece and teaching our communities more about medical advocacy and what those medical advocates can do. I know that you and I talking prior to this podcast, and some of the things that you wanted to talk about, Babs, was the individual level of the medical advocacy and what they do, and also that systems level. And I think that's very important. And you're going to teach me as I'm listening to you.
Oh, I don't know if there's much I can teach you, but
Well, yes, there
happy to
is.
talk about it. So, absolutely. So, medical advocacy, I think, can be looked at in two ways. There is that individual level. So, when a survivor goes to the emergency department for care, for evidence collection, and the health care needed and involved with the aftermath of a sexual assault, an advocate can be with them during that time. And we really encourage hospitals to get connected with the local rape crisis center, understand the services that can be provided, and make sure they're offering those services and calling for an advocate to come in. No one should ever be waiting alone until they get a forensic exam. There should be somebody with them. And even if there is a family member, an advocate can still be there to provide information and referrals and resources. It's an opportunity for the advocate to talk about what they can expect during the exam if that's something the survivor wants, or just be present. They can also provide referrals, like I mentioned. If there's other needs that the survivor has, they can assist with that. And then also, very critically, there can be counseling and ongoing services provided. So that's on the individual level, and that's available within CAPC's region and all through Pennsylvania. And then there's that like systems level. And so, first of all, it's fantastic that CAPC has a medical advocate. I mean, that role is so critical for providing training and resources and information at that like healthcare level. So I'm sure the advocate will be providing training within the hospital, very important, but also within medical offices and clinics, so there, and also to the community. We know that sexual violence impacts health. There was a study that started in the 1990s. It's called the ACE study, the Adverse Childhood Experiences Study. That study, which is ongoing, we know has shown that when there are adverse childhood experiences like sexual abuse or assault in a child's life, domestic violence, substance use and abuse, maybe neglect, or a parent who passed or is incarcerated. All
Hmm.
these things, and there's several other factors, impact a child, obviously, and can also long term impact a person's health in adulthood. And so it's critical to get this kind of training and information around how sexual violence impacts impacts patients in a community, and also how that can be mitigated or
Hmm.
alleviated. And CAPC can provide those services. So wonderful that there's an advocate that's going to be doing that, like systems level work.
We're very excited about that, and I think that we've partnered with our one of our local healthcare providers to get things started on that level. Babs, can you talk a bit more about on the national level as far as the NSVRC? And I think that bringing them into play on that level, how that's linked into the medical advocacy projects.
Sure. So the National Sexual Violence Resource Center is a sort of what the title says, a national resource center.
Hmm.
They are a wealth of information and uh, resources available, often on the state level. PCAR, the Pennsylvania Coalition Against Rape, is connected with the NSVRC. We're actually sort of housed in an umbrella organization. The NSVRC has done a lot of work around issues like prevention and also outreach and awareness. I represent the NSVRC on some national projects, including strengthening sexual assault nurse examiner programs and telehealth. Telehealth, I think a lot of people become more familiar with it due to COVID, where you can consult with healthcare. And we have telehealth programs, some in very rural areas of Pennsylvania, where an emergency department nurse, um, often trained as a SANE, can connect with telehealth services and get support in real time during a forensic exam. So there's a number of national projects and outreach going on, and that's a big one that's happening in the medical advocacy world.
That's really great to note. And I think while you were explaining all of that, I do want folks who are listening and watching this to also understand, if we can go back for a moment, I want to be, really clear that all of us in the victim service world, working with survivors every day, we are trained to provide that accompaniment, that support, the empowerment and options, the trauma informed counseling. And we are also trained to be aware of what the contents of the evidence collection kits are so that we as advocates can provide that information to a survivor. And that helps alleviate a lot of the fear and confusion. And that's another reason, if we can talk about that for a second, right at the start, when you know that you can call someone who is able to provide you from the time that phone call occurs, if it's a hotline call or you're meeting with somebody in the emergency room. And I've done this to help people, so I can speak from firsthand experience that it really does help with the healing process, because the person, the survivor that you're working with, absolutely uh, gains your trust right there. And when you're there and you understand what's going on and you can help them through that, that is so critical, just so critical.
Absolutely. I completely agree. I think advocacy services in the emergency department are essential. They're really an
Right.
essential service. I know right now many hospitals are experiencing nursing shortages.
Yes.
Sometimes patients have to wait long times to get care. Again, no one should wait alone. They should have an advocate, resource available to
Sure.
them. Obviously, it is the survivor's choice, but I think when it's explained what that means, someone can wait with them, provide information, let them know what to expect, and just be that support person. It is very, very important.
Absolutely. I agree with you 110% on that. Babs, could we move into, and again, this is what I'm saying. I'm going to learn a lot just listening to you when we're talking about this. But actually, can we go a little bit deeper in that whole role of a medical advocate over and above the emergency room and being able to provide that and training to medical personnel, both hospital level and office level, like doctors' offices and clinics and things? Again, about that whole systems change in in a county or where we serve. Can you talk a little bit more about that how important that is?
Sure, absolutely. So the medical advocate working on that, again, like systems level, providing that training and information to healthcare providers really is so important. So
Right.
they can talk about, what sexual assault and abuse is, what this may look like for a patient. If a healthcare say a medical office or a clinic provides some resources information, the medical advocate can not only be providing that training to not only the healthcare staff, but also the frontline staff, the people who are doing the check-in or intake
Mm-hmm.
information, just making people aware of what this impact could be, providing things like brochures or posters or information. Healthcare providers might want to learn more about how to be screening for sexual assault, abuse, domestic violence, all these factors
Right.
that can affect health, and then making informed referrals in a compassionate way. We know healthcare providers are incredibly busy. They have been stressed and stretched during these times.
Oh, yeah.
And so the medical advocate can really help alleviate some of that stress by just providing the information that they can provide in turn to patients, and just provide that support too.
Perfect. Wonderful. Um, just trying to think. We covered a lot there as far as what our medical advocate does, what they've done, what they can do to provide that support for victims. Um, Can we talk a little bit more about, and again, I'm going back thinking about what we've already talked about, but a little more detail on what a SANE nurse is, like SANE, sexual assault nurse examiner, and the importance of that and how that ties in with a medical advocate.
Yes.
Thank you.
So, a SANE, as you said, a sexual assault nurse examiner.
Mm-hmm.
Sometimes people use the term SAFE or sexual assault forensic examiner. They're the same, they're just two different names. Is a nurse, it could be a registered nurse, a nurse with a bachelor's or master's degree. It could also be a physician assistant or a nurse practitioner, but they've received specialized training in evidence collection and care for sexual assault victims. So they have above and beyond the training they already receive an ongoing continuing medical education.
Mm-hmm.
They receive a 40-hour course on again evidence collection, um, care assessment. They also learn about the role of the advocate, the importance of connecting with advocacy and making sure those services are offered and provided to survivors. They also get training around the prosecution aspect of it. They are prepared, if necessary, to go to court to testify. So they get this comprehensive training, and then oftentimes some additional clinical skills training is provided just so they have better evidence collection skills and care, provided to them. So that's what a sexual assault nurse examiner is. We really see at PCAR SANES as a best practice in emergency departments. We really encourage that training, and think it's extremely important that a SANE be able to provide that care for survivors.
Babs, could you add on to that a little bit about, and this is something that I'm way behind on, some of the new specialized equipment for the examinations? And I know that that also helps ensure that the evidence is collected properly and it can go through that chain of command. And if that individual ends up in court or there is a trial, then we have a good baseline and a good starting point for that whole court process.
Sure. I think an important place to begin is really the kit itself,
Right.
or the sexual assault forensic exam kit, or a lot of people call it the rape kit.
Mm-hmm.
So every 3 years, the Pennsylvania Department of Health convenes a committee. This is of expert sexual assault nurse examiners. We have advocacy represented. We have the laboratory system, because
Mm-hmm.
kits are sent to a lab for analysis. So this group of experts reviews this minimum standard and those steps for that evidence collection. The swabs, the charting, the techniques involved for that evidence collection.
Right.
So that is happening. That's actually happening this year. Any updates will be in place by the end of 2023. Instructions are included along with that evidence collection piece. So a healthcare provider knows what steps to be doing. Again, we encourage sexual assault nurse examiners because they have that specialized training. Some equipment involved, and it's interesting how I think that has probably evolved over time.
Right.
Photography can be a really important aspect of the forensic exam. Um, of course, any part of the forensic exam, I should say, or rape kit, should be done with the consent of the patient,
Yes.
of the survivor. So if there's aspects of the exam somebody's not comfortable with, it's really important for the SANE or healthcare provider to explain why this is important,
Mm-hmm.
why this may be necessary as part of that evidence collection, so the patient can make an informed choice. Photography, there's training that's available on the photography aspect. Usually it's like a very good high-tech camera, that can be used with some training and techniques to get some good photographs of any injuries
Right.
or anything to corroborate with what was explained during the assault. And then this information is packaged up. It gets handed off to law enforcement. I should explain that there are
Yes.
options for adult survivors. For an adult survivor, there is the option to get evidence collected anonymously or to have evidence tested anonymously. This is definitely a personal choice,
Mm-hmm.
but it should be an informed choice. Because we want to make sure people know what that impact could be, especially if they want to follow through with the criminal justice system. And that's
Right.
again why it's so important to have advocates there, because for hospital staff, there's so much to be doing. When you have that advocate present on that individual level, to provide that information and information about choices that somebody can make, that helps the healthcare staff. That eliminates that burden and pressure on them, and it gives more information to that survivor to make the choice that's right for them. And then if they want to talk to law enforcement, they can have the support of an advocate with them. They can also, if they decide that they need some time about testing of evidence,
Right.
they can take that time and then go back, contact law enforcement. Advocacy can support them while they're doing that, and request, that kit get tested and get that information and make some decisions upon going forward.
And if I can add to that quickly, just for folks listening, The evidence should be collected as quickly as possible. And again, our advocates are trained in how to talk with a survivor who contacts us after an assault. So there are like certain questions that we ask, and we can provide assistance with that. Again, just moving back a little bit, when you spoke about how important it is to have an advocate in the room or there present when you've got hospital personnel, doctors and nurses doing their jobs. The other piece of that is also that we see a lot of our traveling medical personnel, so folks may stay for a short period of time. So can you tell me how, the importance of having a medical advocate to be able to do that policy work and bridging that gap? And can you help us understand how that can be bridged when you've got uh, non-consistent personnel there working?
Yeah, absolutely. And what you're describing, like travel nurses or travel personnel,
Yes.
that is definitely something that hospitals are, they're using because they need staff.
Right.
So when you have someone from another community or another state, they may not be aware of Pennsylvania laws or and all the rights that survivors have.
Right.
So having that medical advocate both on that individual level and systems level is
Mhm.
extremely important. The advocate coming into the emergency department to be with the survivor can talk about legal rights and options. Very, very important. And they can, again, eliminate that pressure and sort of really that pressure and stress on the staff, on the healthcare provider, because they're providing that information directly to the patient. They can also, on that systems level, be providing that training to the
Mhm.
emergency department staff and also making those critical referrals to the Department of Health standard that I mentioned for the
Right.
forensic exam. I recently was connected with a medical advocate at another rape crisis center in Pennsylvania who wanted to bring in a forensic nurse to their emergency department to provide some in services.
Mhm.
Just get some of that basic evidence collection training so that medical advocate is teaming up with an experienced SANE to provide that training on the emergency department level to help, especially people who are not familiar with the Pennsylvania evidence collection standard
Right.
or laws. So it's, bridging that information gap for not only the healthcare provider, but also on that survivor level too.
That's awesome. And I'm thinking, even though we are talking a lot about Pennsylvania, on that national level, anybody else watching or listening to this, I'm sure can go to the NSVRC website and find on a national level contact information, or can they contact PCAR?
Absolutely.
And PCAR will be able to then let everybody know where they need to go in their own state, Commonwealth, etc. I think that's just wonderful. It's just fabulous. Um, I think we're going to, in the last few minutes that we have, Babs, I think really talking about if someone's out there. I mean, someone, what is it? Every few minutes, we have so many people that are assaulted every single day. And if you are out there and you are watching this or listening, help is available. And I think it's so important for us to make sure people know that, and know that when I can speak for CAPSI and our programs in the Commonwealth of Pennsylvania, you are dealing with highly trained, confidential advocates and personnel and volunteers that are there to help you 24/7.
Absolutely, I agree. I think if anyone is, if they need help, they just have questions or wondering, what to do next.
Mm-hmm.
I encourage them to call their local rape crisis center. You can find that at pcar.org. That's pcar.org. The NSVRC website is nsvrc.org to find the state coalition or local rape crisis center. Um, it's important to know that services are available not just in the immediate aftermath of a
Mm-hmm.
sexual assault or rape. Services are available uh, throughout a person's lifespan. If you are a survivor of childhood sexual abuse, or maybe something happened some years ago, um, reach out to the local rape crisis center. You can get support and help. They can advocates can and counselors can help you on that path to healing. It's available regardless of gender or age. It's just really important to reach out. Or if you're a family member, you can
Mm-hmm.
do the same if you want to know how to support somebody. That help is available whenever somebody's ready for it.
Awesome. Any thoughts on agencies, programs? I think most of us in Pennsylvania know that we can come to PCAR to get information on how to get a medical advocacy program started. It's just the means to get it started. But outside of the Commonwealth and throughout the United States, if there's an agency interested in this, any thoughts on referral information, some information to get them started?
Yeah, I would say I think reaching out to the National Sexual Violence Resource Center is very important. So, again, that's nsvrc.org. Um, Communities can also contact their local rape crisis center, which can also get support and services through their state coalition. So, PCAR is the state coalition for Pennsylvania. Every state has a coalition on that state level, an organization on that state level that can help with that information. So there are definitely resources available. And if anyone, if you remember one thing, maybe it's contact pcard.org or CAPC, and we can help you get to the right place.
Absolutely. And CAPSEA's website's simple. It's CAPSEA, CAPSEA.org. And also, if you do go to the PCAR website, we are listed on their site also for contact information. So, one way or the other, we will absolutely be able to hook you up with whatever program you need to get this started and for any type of general help. Uh, Babs, it was an honor again, as I said, to have you on. I'd love to have you on again. I'm looking forward to all of your help getting our medical advocacy program off the ground and blossoming. I think we are going to really do great things, especially with our new project coming underway. We bought a new building recently, and we're going to be able to put all of our services in one building under one roof. And this medical advocacy program is a dream come true. This was a goal of ours for a number of years. So it's
That is
really, really going to be something great. Again, quickly, if you are in our listening area and you need help, contact our 24-hour hotline in Elk County, 814-772-1227, or in Cameron County, Pennsylvania, 814-486-0952. And again, if you are looking outside of our two-county area, CAPSI also can provide you referral information along with PCAR and the NSVRC. Babs, any final thoughts, any words, anything you'd like to get out there?
I just want people to know there is help, hope, and healing available. Um, Please look at the PCAR website, pcar.org, help in PA. If you need to reach out to a local rape crisis center outside of the CAPC area, if you're in the CAPC area, reach out to CAPC. There is help available, and we really want to make healthier, stronger communities, and this is a key way to help do that.
Again, Barbara, Babs, I thank you so much. Again, and you are welcome to come back anytime. And I appreciate all you do for all survivors out there. For Barbara Sheaffer from PCAR, I'm Billie Jo Weyant. Thank you for listening to this episode of Ask the Advocate. Thank you for listening to this episode of Ask the Advocate. If you have a topic suggestion or would like to be a guest on the podcast, you can contact me directly at asktheadvocatepodcast@gmail.com.